Hi folks, hope you're well. If somebody collapsed in front of you right now, would you know what to do? Would you know how to save his or her life? Do you know what to do in terms of managing an emergency? Well, if you want to learn, then watch this video because that's exactly what I'm going to teach you. My name is Dr. Abdul Manan. I'm a GP in the UK. I'm a doctor. I'm also the education director for bluepeanut.co.uk. So folks, Christian Eriksen collapsed on the pitch during a match in the Euro 2020. Some of you might have seen the match. It was a horrifying scene, but thankfully he's doing well now. He's recovering, he's getting better. But we must remember that the paramedics who ran onto that pitch did some vital things to save this guy's life. All right? So these are skills you and I can acquire and do on a day-to-day basis. So watch this video if you want to learn how to do that. Folks, make sure you subscribe, make sure you press the bell button, and make sure you follow our channel so that you can learn from future videos. So what do you do if somebody collapses right in front of you, okay, and you're just there? You need to help out, you need to act, you need to do something. Well, I'm going to teach you a method today that hopefully you won't forget. It will be very easy to remember and you can follow it step by step and save somebody's life should it sadly happen, which it does now and again. I want you to remember doctors ABCD. Alright? Very easy to remember. Doctors ABCD. Alright? Doctors, I don't want you to remember the full word DOCTORS. No, I want you to remember the acronym DRS. So, doctors, in shortcut, it's DRS and then ABCD. Alright? Doctors ABCD. Now, it's an acronym and it stands for a kind of stage process in how to save someone's life, and I'm going to discuss that with you today. I've put some graphics in, hope you enjoy them, hope it's self-explanatory. Any questions, put them in the comments. Anything you want help with, you can let us know in the comments and I'll be in touch with you. Okay? So guys, somebody's collapsed, okay? You're in a scene, somebody in front of you, they're on the ground, they're not moving, they're in trouble. What can you do? Well, first of all, doctors A, B, C, D. All right? D, what does that stand for? D stands for danger, guys. Okay? If somebody collapses in front of you, what you don't want to be doing is just running up to them without checking the scene. Okay? So if somebody's collapsed in a puddle, all right, and you end up, say, defibrillating them, you might electrocute yourself. If somebody's collapsed in a building and there's falling debris, all right, or if there's a fire there, you don't want to end up becoming a victim also. So do not put yourself in danger to save someone else. That's a matter of principle, and it's important that you adhere to that rule and make sure you don't harm yourself. So what you want to do is make sure you are operating in a safe environment. If that means that the victim is moved, if that means that actually you wait for help to arrive, then you do that. You don't put yourself in any danger. Okay? Or you might have to remove danger. So for example, somebody's collapsed and they're next to some live wire or something like that, or that will need moving out of the way. Now if it's safe to do that, so for example, there's a radio playing next to them, or there's a TV, you might have to move that to one side or move the patient or something like that, only if it's safe to do so. All right? So remove danger if you can, otherwise wait for help to arrive so that danger can be removed. Number one, okay? So that's D for you, okay? Easy, can you remember that? The next step is R, okay? So R, what does that stand for? R stands for response. Response means get a response from your patient, all right? Is your patient responding? How do we check that? Somebody's collapsed, all right? So we want to make sure, are they alert or are they conscious? Well, it's very easy to do, all right? Kneel down or get to their level and just pull on a shoulder. Move a shoulder, see if they respond, all right? If they don't, you might want to press on top of the nose. You might want to press on the forehead or above the eyes, something like that, and see if they respond to pain, all right? Pain stimulus, as we call it. See if they respond. If they respond, and they say they're okay, they can't move or something, then it really does affect what you do and what you don't. It means, for example, if somebody's conscious, they respond to you, they're breathing, aren't they? Their heart is working. So it means that's one less of a concern. It's more making sure they're safe now. So response, you need to check that. Okay? The next thing, remember doctors, the S. What does the S stand for? The S stands for shout. Okay? The S stands for getting help. All right? Shout for help. Ideally, if you're there looking after the victim, why don't you get someone else to go and call for an ambulance? Why don't you get someone else to make the phone call to the police or whoever? All right? So shout. S stands for shout, get help. All right? Certainly do not jump in and try and help someone out in a risky situation, for example, without shouting for help, because you might end up in trouble, you might tire out, and in the end, there's two people needing help now because there's no help arriving. All right? So that's what S stands for. Next we move on to A, B, C, D. So what does the A stand for? The A stands for airway. You need to make sure, is the airway open? Okay? So how do you do that? How do you check? Well, again, it's not difficult at all. If it's possible to kind of put the patient on the back, or they are already on the back, then all you need to do is slide their head to one side. So tilt their head slightly. Have a look in the mouth. Look from a distance. Don't just put your finger in. All right? Because again, that might cause the person to have a gag, and then they can bite your finger and you end up without a finger. Now, you don't want that, do you? All right? So be careful not to do that. Instead, have a look in their mouth. All right? See if something needs scooping out, like a vomit or an object or something, like a sweet or something like that. Now, tilting the head alone might mean it comes out, you see, and so you can do that. Now, be careful. You don't want to be moving people around if you feel their back has been injured or they've broken their back or something. So you need to be careful there, all right? Don't move somebody if you're in doubt, okay? But really, the A stands for airway. Is the airway patent? Simply opening up the air, clearing it, it might be enough to make them breathe again, enable them to breathe, okay? So that's A for you. What does the B stand for? Well, simple. B stands for breathing. We want to make sure and check, is my patient, is my victim, are they breathing? All right, let's check, because it's important that they get oxygen into their lungs so they can kind of send oxygen to their brain, other parts of their body, and they're not becoming hypoxic. So the way we check that is quite simple. Okay, it's look, listen, and feel. All right, can you remember that? Look, listen, and feel. All right. So what we want to do is we look to see if the person's breathing. How do we do that? Simple. All right. Look for chest movements. Okay. Look at the face. Look at the movements around the neck. Can you see movements indicative of breathing? Right? You may or you may not. You can also then listen. Listen for breath sounds. All right. Listen for chest movements. All right. Tell everybody to be a bit quiet around you, because things can get a bit worked up around somebody who's collapsed. So just quieten down. Let's have a listen. See if the person's breathing. All right. There's another thing you can do, which is, if you can't listen or if you can't see, is why not put your hand on the chest? All right. And see if the chest is going up and down. So you're feeling to see whether they're breathing or not. Okay. So that's what B stands for. And it's very important you check that. Okay. Next, and this is very, very important, okay? And that is the C bit. C is to check for if the patient needs compression, all right? Check for circulation, all right? So C stands for circulation and compression, basically. It's important to think about circulation because it makes you think about the heart, right? So is the heart working? All right, how do you do that? See if there's a pulse, all right? Do you know how to take a pulse? Very simple, all right? Don't use your thumb, use your fingers. Fingers, and you can press against the waist, all right? So if you think about the person's hand, the pulse is on the thumb side and there. Just, if you see the midline there, 2 fingers there, you should be able to feel the pulse there. Alternatively, the carotid pulse. Basically, you got the midline and just go sideways about 1 inch, press in, and there you go. I can feel my carotid pulse. So you could do that. Okay, there's other ways to measure a pulse. If you've got a machine or there's other parts of the body, but I would say stick to those two areas. See if you can see a pulse, or feel a pulse rather. Okay, if you can't, if you feel there's no circulation, really that person is at risk of dying because the heart is not working, and that's when we need to come in and do some work. Okay, help might have arrived by now. Remember that shouting for help, it's vital that you do that at the beginning, because right now we may need some help. Now imagine the help hasn't arrived yet, so we need to keep the person going. We need to keep oxygen in this person and heart moving. How do we do that? Well, we have to replicate it by doing compressions. The way we do compressions is going up and down on the person's chest. All right. Now, it's important you do that in the right way. Compression has to be done in the right way. So what you want to do is compress or press on the middle of a person's chest. So if you imagine here, I don't know if you can see the bottom of my chest, so you can kind of feel where the rib cage is, right? So you want to press just above where the breastbone is, okay? And the base, the heel of your hand needs to be going on that part of the chest. And I always say, if you imagine the hand, if you can see it sideways, hold your hands like that. Okay, can you see that in the camera? Like that. And then put the heel of your hand on the chest. You can see it in the graphics as well, of course. And then what you want to do is you want to lock your elbow, all right? Both your arms, the elbows need to be locked so that you're actually going up, yeah? You're actually going up and down on the chest and your arms are straight. What you don't want to be doing is this, okay? Where your elbows are bending. Because what that does, you're not going to be transmitting the force onto the person's chest. You want the arms straight, going up and down like that, okay? Up and down like that, so that the force is going onto the chest. And that compression, you need to do one every half a second or so. So really, it's pretty quick. There's a fair amount of force you need to put on the chest. And don't be scared, you need to put that force in. You let the chest come back up, next push. Chest up, next push. Like that, you need to keep going. And you need to do 30 of those compressions. Okay? Now, remember the oxygen bit? We need to get oxygen into the lungs if the person isn't breathing. So after you've done 30 compressions, either you do it or get a helper to do it if there is somebody. And what you need to do now is get some breath into the person, into the victim. How do you do that? Well, the way you do that is simple. You do what we call a head tilt, right? So what you do is with one hand, hold on to the forehead, and with one hand, kind of hold the chin, and then what you do is you simply tilt the head, all right? And what that does, it opens up the airways, okay? And then, of course, you have a look in the mouth again, make sure it's clear. And if it's safe to do so again, give mouth-to-mouth breaths. And you give 2 of them, all right? So a full breath, watch the chest go up, yeah? And then go down. Another breath, watch the chest go up and go down. After that, the chest compressions can continue another 30, and then another 2 breaths, then another 30 compressions, and another 2 breaths, and you keep going like that until help arrives. So that's compression. That's the important part here. All right? Now can we come to the D? All right? Help still hasn't arrived, but guess what? In most places, there is a defibrillator available. A defibrillator is a machine that can give an electric shock to the heart and get it started again. All right? So if you've got one of them available, then we go on to D. If you don't have any of them available, you carry on at C, chest compressions and breaths. Keep going until help arrives. All right? If there is a defibrillator around, these are automated devices. They'll talk you through what to do. You simply open the box, switch the machine on, and listen to it. All right? It will tell you what to do. All right? And I'm going to leave it at that. It will tell you, about safety, about where you need to position yourself, where the pads need to go on the patient's chest, or the victim's chest, shall I say, and when to read, when not to read the rhythm. It will do all of that for you and tell you when to press the shock button. So listen to it, obey, and you should be safe. It's not a problem, okay? Keep doing that, again, until help arrives. So really, that's in a nutshell, doctors, A, B, C, D, guys. Try and understand that. Try and do some reading around it, and I'm sure you'll be really good at doing this. And together we can save a lot of lives. Okay? Look after yourself, take care, and I'll see you again.